What does a sick kitty have to do with 10 million people dying? Let's talk about drugs.
A pet owner calls me up and asks for an antibiotic for her kitten who has some weeping eyes. I explained to her that I needed to see her cat before I could prescribe any medication or treatment, but then she replies, "No, it's the same thing as before. My other veterinarian gave me an antibiotic and it cleared it right up." This is a common dilemma. In a way, that kitten being prescribed an antibiotic inappropriately is leading to up to 10 million deaths in the next 30 years. I'm talking about antibiotic resistance. According to a 2016 CDC report, nearly 1 in 3 antibiotic prescriptions were unnecessary. Prolonged usage and improper low dosing of antibiotics were the 2 biggest contributors to antibiotic resistance. So how does antibiotic resistance begin in the first place? Let's take a bacterial infection. A few of the bacteria develop a natural resistance to an antibiotic class. The veterinarian or physician then prescribes an improper dose or wrong duration of an antibiotic. This kills off good and bad bacteria, leaving the resistant bacteria to thrive. They pass on this resistance to the next generation, then everybody has a big problem. There are currently 41 antibiotics approved for use by the FDA in food-producing animals. 31 of those are deemed medically important for humans. That means this issue of veterinary antibiotic usage affects every human being on the planet. By 2050, 10 million deaths each year will be attributed to antimicrobial resistance. The majority of antibiotics, about 70%, worldwide are used in livestock productions, poultry, cattle, pigs. About 30% of all the antibiotics in the world are used by humans, and only a very small fraction are used in dogs and cats and pets. In another study, the CDC found that antibiotic usage varies from hospital to hospital. Some hospitals prescribed 3 times the amount of antibiotics that a comparable hospital did. This led the CDC to conclude that it was a cultural problem within the doctor and nursing staff. Over the next decade, our species is going to be confronted with some very serious dilemmas. Do we use antibiotics for food production, or do we reserve them for human usage only? These are not easy questions to answer. These are questions that we will have to answer if we're going to survive. Let's get back to that kitty cat. I see a cat with runny eyes. Most clients want an antibiotic. However, that antibiotic is not appropriate in the vast majority of those cases. The science is clear. Most upper respiratory tract infections are viral, not bacterial. That means antibiotics won't help in the majority of cases. Why do most veterinarians and pediatricians prescribe antibiotics when they know that 60 to 80% of the cases they're prescribing them for don't need them? Many times veterinarians and doctors prescribe antibiotics because it's just simply easier than confronting an angry client. You expect it and you feel like somehow you were gypped off or didn't get your money's worth if we don't prescribe you this magical, mystical pill. The reality is, our goal is to guide you through the healing process, not have this programmed pharmaceutical response. I'm asking everyone to be more open-minded when it comes to the healing process. Not every ailment is going to require a prescription. Sometimes you need for your doctor to make sure that your immune system is intact, that you're healthy enough to heal on your own, and then give you advice. Sometimes very simple, common sense advice. Veterinarians, veterinary technicians, veterinary support staff. We have to make sure we're only prescribing and using antibiotics when absolutely appropriate. That means a bacterial infection. That means we've done culture and sensitivity to identify the proper antibiotic and if it will help in that particular patient. Pet parents, Please don't demand an antibiotic when your pet doesn't require it. This puts a lot of pressure on the veterinary staff. They want to make you happy, and so sometimes to avoid conflict and confrontation, they just give you the pills, they give you the liquid, you go on your merry way. The next time your veterinarian doesn't prescribe an antibiotic for your sick pet, don't take it personally, don't get upset, accept it and understand the science behind it. Other contributors to antibiotic resistance include basic good hygiene. Make sure you have written protocols for hand washing, disinfecting exam rooms and tables, door handles, everything in your clinic. Are you routinely disinfecting your stethoscope, bandage scissors, pens, anything you use with patients? And I don't mean once a day, but I mean between every patient. Veterinarians, how often are you changing your lab coats? In between patients? Once a day? Once a week? Do you have written protocols for how you disinfect your tabletops, your cages, your floors, your door handles, the front door, the back door, the exam room door, every surface in your clinic that is touched by you and your team and your clients must be disinfected throughout the day, preferably after every patient. Over the past 100 years, antibiotics have saved millions and millions of lives. Many of us wouldn't be here today had it not been for antibiotics that saved the lives of our ancestors. What can we do today to ensure that we have antibiotics to use in the next 100 years? If you like content like this, please be sure to give a big thumbs up and subscribe. Leave any questions or comments below. Thanks a lot.